If I can help somebody as I pass along, if I can cheer somebody with a word or a song, if I can show somebody where they're traveling wrong, then my living shall not be in vain. Oh, my living will not be in vain. Oh, my living will not be in vain. And if I can help somebody as I pass along, then my living will not be in vain.
Wow is really all that I can say. It's already October, and what a year. We have experienced some good days, and we have also experienced some bad days that have challenged us. And this has all been part of this new era of healthcare. However, there have been 3 constants that I need to share with you. First and foremost is that God will always be at the center of what we do and how we serve in the Baptist health system. Secondly, from our CEO, Keith Parrott, to our board of directors and the executive leadership team, they are seeking to make the decisions that won't forsake our mission to honor God and keep Him at the center of the decisions that have to be made. Thirdly, we have thousands of hearts, voices, and hands that, in spite of the changes and uncertainty, are committed to serve those in need of our care. Our ability to serve in these challenging times is the fulfillment of one of my favorite passages in the Bible. Let us not become weary in doing good, for at the proper time we will reap a harvest if we do not give up. As we press our way into the last 3 months of the year, I want to simply encourage you to finish the year strong. Don't give up being the best servant. Make every patient your first patient. Give them your best smile, your best touch, your best voice, your best words, your best ear to listen, your best thank you, please, you're welcome, and it was my pleasure. Now you will hear from my best friend how your best helped him, me, and my family through one of the most challenging times of our lives.
As a husband, I've always prayed to grow old with my wife. As a dad, I prayed to see my children grow up and see their dreams come true. In 2009, I was diagnosed with a cancer called chronic lymphomic leukemia, which is CLL. It's a blood cancer. I still remember sitting there and hearing the doctor say, "Mr. Boswell, you have a cancer." He described it as a watch and wait cancer. In other words, we don't treat the cancer until your blood count gets high enough. I sat there, not understanding fully what he'd said. What I did recall was my prayer to grow old with my wife and to see my children grow up. I also remember wondering, how will I tell my children that I have cancer? The doctor handed me some literature and said, "Don't worry, come back in a month for lab work." He never said, "I'm sorry to have to tell you this news." He just gave me, just like any other patient, he just delivered the news just like he'd done probably a million times before. But this news really changed my life. My family encouraged me to get a second opinion. I went to Dr. Katisha Vance at Princeton. On my first visit, she walked in, smiled at me and my wife, and sat down and just began to get to know us. She wanted to be sure that we felt comfortable despite the reason we were there. She even called me by my nickname rather than Mr. Boswell. That little thing, calling me Chip, started to build a relationship of trust. She was different than the first doctor. She confirmed the diagnosis of leukemia and said, "Chip, I'm sorry that you have this disease, but we will treat it. You'll be okay." She made no promises, but she gave me hope. She took a few minutes to show me and my family that she cared about us. We mattered to Dr. Vance. It was on that day that she became my oncologist, hematologist, and Princeton became an important part of my life. I began treatments on October of 2009, completing them in March 2010. And then in 2013, Dr. Vance sat down with my family once again and let us know that I had developed a complication with leukemia that less than 1% of CLL patients experience. The CLL had entered my central nervous system, and there were no treatment that could guarantee the change to change this complication. She said that there may be no cure, but she would do everything she could. I heard what she said, but my trust was in God, and I knew that He would hear my prayers and answer my prayers to have a long life with my wife and to see my children's dreams come true. The treatment required me to have several chemotherapy treatments through lumbar puncture. The lumbar puncture were painful and uncomfortable. I had to prepare myself mentally for every one of the 20 treatments, sometimes twice a week. Through prayer, God got me through those treatments. And God also used many of the staff members in radiology to encourage me. The smiles and laughter that I got when I was greeted in the admitting encouraged me. The time that the nurses took to ask me about my family encouraged me to hang in there. The time that the nurse and the radiologist took to calm my fears and anxiety at my bedside. Even the radiologist apologized for the pain. That 1 minute that the hospital staff took to share a smile, listen, explain things, hold my hand, even shed a tear at me, was often the medicine that I needed. Near the end of my treatment, several of the nurses got a bouquet of balloons to celebrate the end of my treatment. They touched my heart. None of the people who cared for me could take away my cancer, but they touched my heart and changed my life, and I'll never forget that. I will forever hold my prayer to grow old with my wife and to see my children grow, and I will forever be grateful for you. Thank you.